Oh, it's going. I think. Yeah, it's going.
I'm Alexis Kinder, and I'm in the dental assisting program here at the Springfield Clark CTC. Today I'm going to show you how to assemble a syringe to administer local anesthetic and then how to disengage the syringe. First you'll need a syringe, a long or short needle, depending on the location of the injection. Anesthetics such as epinephrine or anesthetic that doesn't contain epinephrine, but that kind of depends on the patient and what their medical history is. You'll need a recapping device, a sharps container, and gauze filled with rubbing alcohol. We're going to be working on tooth number 30, which is the mandibular right first molar, but in simple terms, it's your back molar on your right side on the bottom. And since we're working on your back bottom molar, we're going to use a long needle, and we call this an infiltration injection. Epinephrine is used to prolong the duration of the anesthetic, but if you're pregnant, have heart issues, have high blood pressure, or other similar conditions, you'll need a non-epinephrine anesthetic. And but we're just going to use epinephrine during this. So I'll select a cartridge that has epinephrine. This one doesn't. This one does. Okay, so we'll use this one. First, you'll disinfect the cartridge on the bottom with rubbing alcohol.
Are you starting on
And then we cover that out so it doesn't get dried out. Disinfect that. You really want to disinfect this side because that's where the needle is going to go through, and that's where you want it most sterile. Then we're going to load the syringe. So this side right here is where the needle's going to go through. So we're going to put it through there. So that way go in. And then we're going to engage what we call like the harpoon. This is the harpoon. And we just tap that in. So that way it kind of looks like it's not a needle, but it like jabs into this little cartridge right here. So that way you can release the anesthetic into the needle. So once you have that engaged, we're going to choose the long needle since we're working on tooth number 30, and it's in the very back of the mouth. So you want that long needle so we can reach it. So we'll just take this off, and then you stick this needle in here and screw it on. We'd pass it to the dentist like this, and then the dentist would receive it like this to give the injection. And then we would uncap the syringe. Get hold of it.
Mm-hmm.
Okay. Wait, keep hold of it so I can take the lid off. We'd uncap it like this, and then we'd put the needle in a recapping device immediately after uncapping it. And then we take it like this away from the needle, so that way you don't risk being stabbed by the infected needle. Not infected, but yes. So then to undo it, we would unscrew the needle. And then we're going to use the one-handed scoop technique and scoop the cap like that and do that. And then we would throw this in a sharps container, which I don't have with me right now. So we put that aside. And then we're going to disengage the harpoon. So you just pull back and then go like this so you can receive the cartridge out of that. And then you're done.